Hi guys, welcome to the Healthcare channel. Today's video we'll talk about, does alcohol protect you against COVID-19? The novel coronavirus, COVID-19, has been the most topic of conversation on television, social media, and even in our own homes over the previous couple of months. As more cases have come to light across the US, the pandemic has affected every American, causing widespread panic and uncertainty during this trying time. It's natural for humanity to feel vulnerable at a time like this, to be scared of the unknown, to debate our concerns, and appearance to others for support. Yet, if you're currently battling an alcohol use disorder, AUD, this pandemic brings to the surface a singular set of concerns of its own. An AUD may be a chronic, relapsing disease that's diagnosed supported a private meeting a particular set of criteria within a 12-month period. Regardless of the quantity of alcohol an individual consumes, though, since alcohol consumption can weaken our immune systems over time, a person with problematic drinking behaviors are often among the foremost vulnerable populations for getting COVID-19. While flattening the curve is that the nation's priority immediately, we understand that the unique needs of people battling alcoholism are equally as urgent, maybe even more so during this point of social distancing and residential quarantines. Alcohol is understood to be harmful to health generally, and violence, including intimate partner violence, and may cause alcohol poisoning. Sometimes of lockdown during the COVID-19 pandemic, alcohol consumption can exacerbate health vulnerability, risk-taking behaviors, psychological state issues, and violence. WHO, Europe reminds folks that drinking alcohol doesn't protect them from COVID-19, and encourages governments to enforce measures that limit alcohol consumption. How COVID-19 affects those battling alcoholism. With the threat of COVID-19, an individual with problematic drinking behaviors may face 1. Anxiety. 2. Loneliness, are often brought on by the necessity for social distancing and being instructed to stay in our homes. 3. An alcohol-related decrease in system health and therefore the potential for increased susceptibility to certain infectious processes. 4. Drastically restricted access to alcohol, which can cause symptoms of alcohol withdrawal. During this point, it's important to acknowledge and understand these challenges that you simply may face so as to avoid using alcohol to self-medicate, potentially increasing certain COVID-19 related risks. Anxiety when faced with the unknown. Its attribute to stress. And when faced with the unknown, even the foremost steadfast among us can undergo periods of fear and doubt which may lead a number of us to self-medicate in whatever way we feel works best. With the continued threat of COVID-19, it's understandable why many may feel stressed and anxious for themselves or their loved ones. If you're also battling alcohol, you'll experience anxiety as a side effect of the disorder, thus enhancing your feelings of unease during this confusing time. Furthermore, not fully understanding the potential of what this virus can do, receiving contradictory information on television and online, and therefore the fear of losing your support also can be scary. However, reaching for a glass of alcohol can enhance your anxiety or make it more likely for problematic patterns of alcohol use to start out or continue. Studies show that there's a transparent relationship between anxiety and odds. Both prolonged drinking and alcohol withdrawal is related to an increased incidence of hysteria. 21 study estimated that 18.3% of individuals with general mental disorder self-medicate their condition with alcohol while 3.3% self-medicated with alcohol due to panic disorders. 3 Additionally, nearly 13% of individuals with anxiety who self-medicated with alcohol developed an AUD, supported the National Epidemiologic Survey on Alcohol and Related Conditions. 4 To combat your feelings of hysteria, it's going to be helpful to remain off social media sites or limit the quantity of your time you spend watching the news every day. Being proactive about your psychological state can help reduce triggers which will keep you during a constant state of worry. While the threat of COVID-19 is real, your psychological state should be the most priority also. Get outside, choose a walk or run, eat balanced meals, and make restful sleep a priority. Isolationism from your network. In an attempt to flatten the curve and minimize the spread of the coronavirus, the Centers for Disease Control and Prevention (CDC) have advised Americans to abide by social distancing strategies, by staying home, keeping 6 feet far away from others publicly, and at this point, congregating in groups no larger than 10 people. The challenge with this recommendation, though, is that if you're battling alcoholic abuse or have an AUD, you'll already be feeling alone. Studies have shown social withdrawal increases loneliness and depression, which themselves could also be factors related to drug abuse. 6.7 In these cases, isolating from friends and family, while important to minimizing the spread of COVID-19, may have an unintended adverse effect because it may deduct your ability to socialize together with your network. For many battling alcoholism, creating and maintaining healthy social connections fuels their motivation to either stay sober or continue working towards sobriety. It's no surprise then, that during a time like this, you'll be feeling even more vulnerable and potentially triggered to select up an alcohol. Thankfully, technology has made it easier to attach with our loved ones whenever and wherever we are. Use this point as a chance to talk with friends, relations, therapists, or anyone who may assist you get through these uneasy times. As we all still socially distance ourselves, some programs have also begun offering a weakened system. The coronavirus family of viruses, and therefore the human illnesses related to them, for example, respiratory infections starting from the cold to more severe diseases e.g., MERS, SARS, are not new us. COVID-19, however, may be a new virus whose symptoms may range from mild to severe, with the potential for more serious and in some cases, lethal illness in people over 65 plus also as those with pre-existing medical conditions and/or weakened immune systems. 8 Currently, around 1 out of each 6 people that get COVID-19 becomes seriously ill and wish immediate medical attention. Over the years, studies have shown a transparent association between excessive alcohol consumption and a weakened system, specifically, when it involves a person's susceptibility to pneumonia. 9 Due to this, those diagnosed with AUD could also be among a very vulnerable population. Yet, albeit you think that you'll have your drinking in check, research shows that even non-chronic alcohol drinkers can still face negative health consequences. In fact, acute binge drinking also compromises the system. Alcohol abuse also can cause various issues together with your cardiopulmonary system, i.e., heart and lungs. In times like these, our bodies got to function at their highest levels so as to repel the symptoms of this virus and reduce the potential harm of COVID-19. But care must be taken, even in only getting sober. Although you'll be tempted to quit alcohol use altogether until a vaccine for the coronavirus arrives, if you've developed a physical dependence thereon, you'll face serious or life-threatening symptoms of alcohol withdrawal. In order to stay individuals as comfortable and as safe as possible, medical detox is an important initiative in combating alcoholism. Although alcoholism may be a chronic, relapsing disease, with professional treatment and ongoing recovery efforts, this disease could also be effectively managed. 10 Treatment for problematic alcohol consumption can hamper, stop, or altogether reverse many otherwise progressive, drinking-related health issues. Restricting alcohol access during the COVID-19 pandemic. Alcohol is liable for 3 million deaths a year worldwide, a third of which occur within the WHO European region. Not only is this the region with the very best alcohol intake and therefore the highest prevalence of drinkers within the population, but it's also the region with the very best prevalence of alcohol use disorders within the population and therefore the highest share of deaths caused by alcohol, among all deaths. Alcohol is consumed in excessive quantities within the European region and leaves too many victims. During the COVID-19 pandemic, we should always really ask ourselves what risks we are taking in leaving people under lockdown in their homes with a substance that's harmful both in terms of their health and therefore the effects of their behavior on others, including violence, says Karina Ferreira Borges, Programmed Manager, Alcohol and Illicit Drugs Programmed, WHO, Europe. Existing rules and regulations to guard health and reduce the harm caused by alcohol, like restricting access, should be upheld and even reinforced during the COVID-19 pandemic and emergency situations, while any relaxation of regulations or their enforcement should be avoided. This must be complemented by communicating with the general public about the risks of alcohol consumption and maintaining and strengthening alcohol and drug services. In our next video, we will talk about how does aging affects your health. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle and other helpful information to form life easier.